Hello everyone, I hope you're doing well. My name is Elia Rosado and today I'll be talking about the ethical issues of birth control. Access to some form of birth control can drastically reduce unintended pregnancy as well as improvement of health and well-being of women. According to the Committee on Healthcare for Unintended Women in 2017, more than 99% of women who are sexually active have used some form of birth control at some point in their lives. With so many people using contraceptives, this is an important healthcare topic. I select this topic because like I previously mentioned, there are so many people using contraceptives. Also, as a woman, this mattered to me because I don't only see it as a way to prevent pregnancy, but something that could improve the well-being of women. Now let's talk about the ethical issues I introduced in my paper. First, how does the cost of a contraceptive affect its availability to patients? In my research, I found that the most effective contraceptive method is also the most expensive. Therefore, not everyone has the opportunity to access these contraceptives. 2. Should the religion of a healthcare worker or facility affect the patient's access to contraceptives? Personal belief of a healthcare worker shouldn't influence the quality of care they provide their patient. However, I learned that if a hospital have a religious affiliation, then the hospital can choose to abide by the rules of the religion. 3. Should a woman make decisions about her own body? Should a husband make decisions about his wife's body? Well, yes, women should be able to make decisions about herself and what happens to her body. And if a husband wants to make a decision about his wife's body, then he should discuss it with her. Then 4, how should the effectiveness of a certain contraceptive over others be considered when it's recommended? I found out that it depends on the patient's need, like whether they're trying to prevent pregnancy, help with cramping and heavy periods, or protection from STDs. According to the CDC, when recommending contraceptive method, a healthcare worker should start with the most effective to the least effective. 5. Should healthcare workers keep patient requests for contraceptives confidential even if they're a minor? I was able to find that even though if a patient is a minor, they're allowed to receive treatment without their parent consent. Now let's talk about my code of ethics. As a medical assistant, my code of ethics includes providing service with respect patient confidentiality, keep and pursuing professional standards, being willing to continue to spend knowledge for the benefit of the patient, and to participate in service activity for the benefit of the community. With this being said, my code of ethics relates to this topic because as a medical assistant or any other healthcare professional, our duty is to facilitate and provide the best care. Something that I learned from my paper is my code of ethics. Also, I learned that Catholic hospitals have the right to deny access to contraceptives to their patients. Alright, so that's all for today, and thank you for listening and stay safe.